Hi, my name is Liz Olson. I'm one of the nurse practitioners and LARC providers here at Student Health and Wellness. I'm here to introduce the NEXPLANON implant for contraceptive purposes. Implantable subdermal contraceptive devices are over 99% effective as a form of birth control and are a part of the LARC, or long-acting reversible contraceptive family. NEXPLANON contains a synthetic form of the hormone progesterone similar to Depo-Provera and the hormonal IUDs. It works by slowly releasing hormone over 3 years to prevent ovulation. NEXPLANON are more effective in preventing pregnancy than condoms, withdrawal, and other forms of hormonal contraceptive, mostly because they work independently of you, the patient. You don't have to remember to come into the office to get a shot or remember to take a pill every day. Besides contraception, contraceptive implants are also used to help with heavy menses or crampy menses. The implant is inserted by a provider just under the skin in the upper inner arm. The most common side effects of the implant are irregular menstrual periods. You may have no bleeding at all, or prolonged spotting, or very light bleeding for months, or something in between. The light bleeding should not require more than a liner or a light tampon. If you have bleeding where you're changing your pad several times a day for more than 2 weeks, or if you are ever changing a pad or tampon more than once an hour for several hours, you should contact your provider. There is a small percentage, less than 10%, of people who have headaches, nausea, moodiness, breast tenderness, acne, weight gain, or other issues in the first week that they have the implant, as their hormone levels rise up, then fall, and then plateau. Most of the times these symptoms resolve. If they do not, you should talk with your provider. There is a very small risk of pregnancy with an implant, less than 1%. However, because of the probability of irregular bleeding with the NEXPLANON, you may not know that you're pregnant if that does happen. If you start having pelvic pain, nausea, breast tenderness, or any other concerns, you need to be seen right away and take a pregnancy test either at home or at your provider's office. There is a small increased risk of ectopic pregnancies, or a pregnancy outside of the uterus, that is not consistent with a normal pregnancy and cannot be carried to full term. However, the risk of getting pregnant with the implants is so much less than if you were not on birth control or on another form of birth control that it is unlikely to occur. Remember, you can call the SHCS advice nurse if you'd like to talk with a medical professional about any concerns related to the implant. There is also a very small risk of migration or breakage of the implant. From the insertion itself, there is risk of localized infection, pain, bruising, and there will be a very small 1 to 2 millimeter scar. How to prepare for your implant. It is important that you and your partners have been using consistent contraception for at least the 2 weeks prior to the insertion of the implant if you are engaging in penile vaginal intercourse. This means that you are using condoms every time for the whole time that you have vaginal sex, or that you are abstinent, or that you are using birth control pills or another hormonal method. We don't want you to be in the process of getting pregnant at the time of the insertion, so this is very important. We will perform a pregnancy test when you arrive, so be prepared to give us a urine sample. You may bring someone along with you to the procedure if you choose. They can sit in the room with you or wait for you in the lobby. In terms of the insertion itself, your provider will go over a consent form with you and answer any remaining questions that you may have prior to starting the procedure. You will lie down on an exam table with your hand up by your head. We typically place the implant in your non-dominant arm, but it can go in either arm, your preference. We will mark the area where the implant will be inserted and then clean the area and inject a medication called lidocaine that will numb the area of the arm where we place the implant. We will clean again with a stronger cleanser and then insert the implant through a large bore needle. It only takes a few seconds and you will feel pressure, but you shouldn't feel anything sharp. We then place a small bandage and over that a larger compression bandage to help with bruising. After the insertion, your provider will go over infection precautions with you so that the site of the insertion stays clean and healthy. There is no follow-up appointment needed. We advise that you use backup protection if you are having penile vaginal intercourse for the first week after getting your implant. This may include condoms or continuing your hormonal contraception through the week. You may call the advice nurse if you feel like something is not right with the placement or if you are feeling sick from a possible infection. Here are some tips. You can be anywhere in your menstrual cycle to have the implant placed. You are not protected against STIs with the implant. We still recommend using condoms with your partner and being tested annually or when you change partners. Implants do not affect your fertility. When they are removed, your fertility will revert back to what it would have been at your age. We will not make an incision to place the implant. That's why your scar is only 1 to 2 millimeters long.